Did you know that in 2024, over a dozen states in the US have near total bans on abortion? And millions of women are now forced to travel hundreds of miles just to access basic reproductive care. I want you to think about the most important woman in your life. That could be your wife, mom, sister, best friend, or even your favorite neighbor. Now, I want you to think about if that woman was sexually assaulted and forced into an unwanted pregnancy. Would you think she deserved to be forced to carry the pregnancy to term? Every woman who may need to seek out abortion care is somebody's mom, sister, or best friend, and they all deserve access to abortion. Abortion is not just a legal issue, it's an attack on autonomy and a public health crisis. Today, I want to shed light on the Women's Health Protection Act, or WHPA, and talk about why it matters now more than ever in the fight for women's abortion access. The WHPA is a proposed federal law designed to protect access to abortion services and prevent states from imposing unnecessary restrictions. It was created in response to the Supreme Court's 2022 decision in Dobbs v. Jackson, which overturned Roe v. Wade and gave states full power to ban or restrict abortion. Since then, women, especially those who are in low income, living in rural areas, or from minority communities, have been put in a position where they are now experiencing fewer reproductive rights than their mothers or their grandmothers. Your zip code shouldn't determine your rights to healthcare access. Many now face travel costs, legal threats, or dangerous delays just to get the care they need. This policy is a direct response to that injustice. When access to abortion is restricted, health outcomes suffer. Studies have shown that women denied abortions are more likely to experience long-term poverty, worse physical and mental health, and even higher risk of maternal death. In fact, the U.S. already has one of the highest maternal mortality rates in the developed world, and Black and Latino women are hit the hardest. The WHPA could help turn this around. By creating a national standard that overrides restrictive state laws, it would ensure that access to abortion care is based on medical need, not political geography, and support women's autonomy over their health. So what can be done? First, the WHPA must be strengthened. It needs clear enforcement mechanisms, funding for reproductive health infrastructure, and protections for patients traveling across state lines. And to make this happen, we need voices from the front lines, especially health service administrators. If you work in healthcare, you have the power to advocate for policies that save lives. Share data, write to your lawmakers, collaborate with public health departments, and support your staff and patients in navigating these challenges are all ways health service administrators can be involved. If you're not a healthcare professional, you can still spread awareness to your people, donate to abortion funds and clinics, vote in support of reproductive rights, and donate or volunteer with organizations doing the work on the ground. The Women's Health Protection Act could be a turning point in the fight for reproductive justice, but it won't pass or be improved without our effort. Health policy is not just paperwork, it's about people,